In today's video, I'll be sharing some ideas for how to bring up the fact that you have concerns for your own mental health with your healthcare provider. Hello there. If you're new, welcome. I'm Liz, and I am a family nurse practitioner working in primary care. Working with patients to improve their mental health and treat conditions such as anxiety and depression has always been a huge part of my job in primary care, but over the last year with the pandemic, it's become something I talk about with my patients legitimately all day long, and I'm really happy about that. I'm really happy people are talking to me about it finally. In recent videos, we've talked about my own experience with anxiety and depression, starting Zoloft, the side effects, taking it, how it's been, and what I wish every single person was told about starting an SSRI or an SNRI for anxiety and depression. If you want to check out those videos, I'll link them down below. But from those videos, one of the most common questions I got in the comments was, I think I may have anxiety or depression, but I have absolutely no idea how to bring this up with my healthcare provider. So today I thought I would offer a few different ways so that if that's you and you want to discuss these things, or you just have any general concerns really, you have some words to use to kind of get you there. The first thing you will need to do when approaching these conversations and appointments is calling and making the appointment. And typically the front desk will ask you, hey, what's your name, blah, blah, blah. What would you like an appointment for? And this is the very first thing that I found patients completely and very understandably struggle with, because this person is a stranger and you're like, don't want to really tell you all my things. So it's very appropriate to just say, I'm feeling anxious, or I'm feeling worried. I think I might have depression. That's all totally fine, and there's nothing to be ashamed of for any of those situations. This is not your fault. Just because we don't have a lab value to associate with mental health conditions does not in any way take away from how real and disruptive they are to people's lives. And there is help. So first, I want you to know that, I guess, before we dive into everything else. Really, really absorb that. This is not your fault, and there is help. Actually, we're going to do a little exercise to help remind you that this is fixable before we dive into everything else. When I was so struggling with depression after the birth of my first child, I felt absolutely hopeless and things just seemed so incredibly bleak. And I know some of you may be feeling like that. So I want you to remember, and I want you to kind of repeat the following thing. This is not my fault, and it can get better. Something is even as simple as that was so helpful to me the second time around when these feelings came back. And I knew that it was happening in the first few months of the pandemic. And that really helped squash the part of my brain that was feeling so much shame for my constant anxiety, because even though I literally manage like new diagnoses of anxiety and depression all day at my job and tell everyone like, this is not your fault. Like, this is a thing. This is not all in your head. I still felt like it was my fault. And repeating that little mantra helped me get out of my head and into a headspace where I could imagine asking for help. And so that's kind of my mantra that I've been using going into that. This is not my fault, and it can get better. Okay, let's go back to making the appointment. If you aren't comfortable telling the front desk that you are worried about anxiety and depression, which is absolutely fine, friends, it's okay if you do not want to say that. You could leave it as a blanket statement by saying that your appointment is for mental health, you are feeling really tired, or whatever symptom that you are feeling. Often I have patients making appointments for chest pain, heart palpitations, insomnia, GI upset, so like nausea, vomiting, diarrhea, or just I don't feel well. When in doubt, while it's not hugely helpful for the provider because they can't really plan for the visit, you can totally just say, I don't feel well. And that's a very acceptable answer. If the front desk presses you on it, just say, I'd really rather discuss this with my provider. And that's totally fine. Just know that there might be a little bit more paperwork at the time of your appointment, because they wouldn't know that they should like screen you for anxiety and depression with things like the GAD-7 or the PHQ-9 for anxiety beforehand or in the waiting room if they weren't aware that that's what the appointment is for. But it's still totally fine. And I promise, any decent healthcare provider would rather be surprised for the reason of your visit if it meant you were going to come in and get help with your concerns, rather than having you stay at home because you don't feel comfortable disclosing what the appointment is for to the person at the front desk who you don't know and may not want to tell your innermost secrets to. And one more piece of advice for the appointment, try to make it the primary topic that you'll be discussing at the appointment. I would absolutely love to have more than 15 to 20 minutes for visits with my patients. But because insurance companies pay so little for things like primary care services, companies usually make appointments shorter in order to try to recoup some of the costs, which is why FYI primary care appointments are so short, and specialties can have much longer appointments as they get paid a lot more, like 3 times at least as much. Anyway, in a perfect world, we would have plenty of time to discuss everything, but in the real world, we just don't. And diving into mental health assessments and diagnoses and education and potential medication guidance takes every single minute of the 15 to 20 minute visit. So it's ideal to have this to be really the main thing you want to talk about at your appointment. So I will often have patients bring up their mental health concern in the last 3 minutes of a 20-minute appointment that they made for something else like blood pressure or cholesterol. And it's impossible to try to give that concern the time it needs. And your mental health is worth the time. And I know appointments are so expensive, and it seems way more appealing to bunch this in with your hypertension checkup and your left ankle that isn't working. But if you can swing it, this should ideally be the only concern and thing that you bring up during your appointment so that it gets the real attention that it deserves. All right, so you've made the appointment. Awesome job, go you. That's honestly one of the hardest steps, is just getting the motivation to make the appointment, which is hard if you're depressed, so it's a really nasty cycle. Anyway, go you, or you're anxious and you don't know what's gonna happen. Now let's plan what you're going to say during your appointment with your healthcare provider, because again, being as direct as you can is going to be beneficial because there's no time lost dancing around topics until you try to get to the source of the concern that brought you in on this day. I so hope that you have the relationship with your provider that allows you to say, I'm really not doing so well, and I have been anxious, or however you have been feeling with whatever those symptoms are. But I understand that you may not have that relationship, and it can feel really vulnerable to have the words come out of your mouth. So here's a few examples of things that you can say to the answer to the question of like, hey, what brings you in today? I'm just not really myself. My spouse says I seem depressed or anxious. I'm having a really hard time concentrating because I feel like my mind is constantly worried about so many things, and it's really distracting. I've been having this chest pain and I feel like I can't breathe when I'm super stressed with work or my family or just thinking about everything. I don't want to do anything. I am so tired. Literally all I want to do is just lay in bed. I can't stop worrying about everything. I've completely lost my appetite and I don't enjoy the things I used to. I have been snacking a lot more than usual, and I think it might be related to how overwhelmed I've been. Those are just some ideas, and whatever your wording choice is, practice it at home. There really are no wrong answers here, and write it down in a note on your phone. That way when you are asked the question or any concern you have, you can reference your phone or a list, and you don't have to worry about forgetting anything, and you could literally read straight from the form or the note if that's what brings you confidence to say, hey, I feel like I'd never want to get out of bed anymore. Focusing on your symptoms that your anxiety and depression are causing can be a really great way to ease into the conversation without using the words, hey, I think I have anxiety, or hey, I think I'm depressed, if those words are really kind of hard to bring up for you. Most of those symptoms should quickly prompt your healthcare provider to start asking you about your mental health, and then at that point, the conversation can begin. However, if it doesn't, it should start some kind of conversation, and you can then bring it up as a potential cause. Now, when you're bringing it up, like let's say you have to bring it up and you don't feel comfortable saying, could this be depression? You can use a wonderful trick where you use your friend as a as like a gateway to this conversation. My friend and I were talking, and she says she felt a lot of these things too. And she was actually told that she had depression, and they started her on some medications, and she's doing way better. That's actually what brought me in today. It doesn't matter if you don't have a friend with this. Friends are ideal to blame things on, because particularly imaginary friends, because they are not your family, so they don't affect your family history, which goes into your chart. So we don't put your friends in your chart. Saying your sister or your mom have these symptoms when they really don't could affect the way that we view the appointment, because there is a genetic link to mental health conditions, and it may falsely lead the provider to thinking you do have anxiety or depression when really it's your thyroid that's going absolutely insane. Which brings me to my next point of make sure they do some other type of questions to make sure it's not something like your thyroid. They may want to get labs or get an EKG or get some other assessment to make sure the symptoms aren't being caused by your heart, by your thyroid, by your gut. A few questions will often be enough to help someone come to this conclusion, but just know that they may ask you about a few other random things that don't seem related at all to you, but they're just trying to make sure that you don't have anything else going on. All right, so you've already done a lot of things here. You've called, you've made the appointment, you've had the appointment, you've voiced your concern, and you have been diagnosed with anxiety or depression or whatever is going on. And it comes time to talk about your treatment. And here's where you may need to stick up for yourself a little bit, because I've heard so many stories from all of you and my patients of how you were just told to add some yoga and deep breathing to your routine. And my friends, that is not quite enough for people a lot of the time. It's an absolutely great add-on. Lifestyle things, it is a great add-on, but it is not the end-all be-all. And it is coming from such a stance of privilege to recommend trying therapy first, or going on more walks, getting more sleep. And while I love all of those things, I think those are the best things and they're very important to your mental health, it is not financially available or time available for a lot of people. And it is your job as a healthcare provider to meet your patients where they're at. That is your provider's job. And if for whatever reason you aren't able to implement other supplemental life changes right now, and you would rather just jump right to starting medication, or for whatever reason you want to just start medication, that is okay. Because a lot of the times, even when you do all of those other things, it's just not enough. And are they great to add on? Yes. But are they always enough? No, a lot of times they're not. And that is okay. So you may need to advocate for yourself. You're not failing because you want to try medication before you do therapy or before you start only eating broccoli. You may need to advocate for yourself here. You are not failing because you want to try medication right away or whenever, no matter what the internet tells you. And the internet is going to tell you a lot of things about how you can just yoga and meditate your way out of this, or no matter what provider may tell you. This is not your fault and this is okay. And as someone who has been incredibly anxious and depressed and had someone say to me, well, are you exercising enough? Have you thought about therapy? I'd prefer you start here. I don't want to get out of bed. Do you think I really want to go and exercise all the time? And do you think I have $65 a week to throw at this? Because that is a lot of money. No, like help me get, a lot of times medication can even get you to the point where you could imagine doing these other things. So it's okay to stand up for yourself. And if you are facing a situation where you are being told to just like deep breathe your way out of your situation, this is how I recommend tackling it. Express your interest in some kind of medication. You could blame it on your friend again. Again, this friend is very helpful. That friend I was telling you about actually got started on some kind of medication called Zoloft and feels a ton better. Is that something we could try, or some kind of medicine like it? You could also go from the angle of being like, I'd love to be able to implement all of those changes because they do sound like they would be really helpful, but is there a way we could add some medication in the meantime so I can kind of get to a place where I could imagine doing those things? I feel like that would be really helpful. Or you could just say, I've actually given this a lot of thought and I would really like to try some medication for this as well. Whatever you want. But it is absolutely okay and encouraged for you to advocate for yourself and ask questions. This should not be like a provider telling the patient exactly what happens all the time in their life. Should be a provider explaining the options and you get to pick what works best for you. You can do this. You might need to fight for yourself. And it really sucks that other people aren't going to be fighting for you in this corner all the time, especially when you kind of feel like the fight is out of you. So again, you can write this down on a note card. You can do this and read exactly off your note card or your note in your phone to kind of give you a little bit more confidence, and go for it. You can do this. You deserve to feel better. And you can, I promise, however you want to feel better. If you want nothing to do with meds, that's totally fine. Advocate for therapy. You should be able to advocate for what you deserve. Also, I just want to say I'm not in any way knocking all of those other things. I feel like it comes off that way a lot of times. And I find exercise to be incredibly helpful with my mood. Yoga relaxes me. P.S. Yoga with Adriene is a totally free YouTube resource. 10 out of 10 recommend. I will link her channel below. Deep breathing gets me out of spirals sometimes, and dang, am I a sad and miserable person if I do not get enough sleep. And I really honestly do look forward to the day where I can go back to therapy. But Zoloft has made it feel like I can do the day. And for that, I am incredibly, incredibly grateful. And that's that. I hope that you feel a little bit more empowered to talk about things with your healthcare provider and maybe even have some words now to do so. But whatever words you pick, seriously, write them down, even if it means that you randomly blurt them out in the middle of talking about something else with your provider, totally out of context. It's totally fine. I've had this happen more times than I can count once people kind of get a little comfortable and we're talking about their dog and they're like, I think I'm depressed. I'm like, okay. It doesn't faze me at a little, and it shouldn't faze your provider at all. And if they are being a total turd, you can always find a new one, because you deserve to have someone who validates you and listens and helps you be your best self. Okay? You really do deserve it. So advocate for yourself here, friend. If you want to check out those other videos about my own experience with Zoloft, both before it worked as well as after, I will leave those linked down below, as well as a video talking about exactly how some of those anxiety and depression medications work. Also, feel free to share your own way of discussing this below, or if you're a healthcare provider and you'd like to share ideas or experiences with this as well, all input, as always, is welcome. The comment sections in these videos is usually where the most helpful information is. I feel like my video starts it and then it's like the real good is in the comments. And we would all love to learn from you, and if you care to share. Now, please remember that your feelings are valid. They are not your fault, and that things can and will get better. You can do hard things, friend. And if we can make it a little bit easier with a little bit of store-bought serotonin or whatever you want, let's do that. Have a great week, guys. I'll see you next time. Bye.